A really emerging theme in our field of myelofibrosis is the add-on therapy approach. So you're already on your JAK inhibitor, but you're having a suboptimal or not quite 100% response to that. And so rather than coming off of the JAK inhibitor and trying something new, this field, what we're trying to do is stay on your JAK inhibitor, but then get onto the clinical trial and get the second agent. And so there are three agents right now that are in advanced development stages, so-called phase 3 randomized studies, multinational studies. And again, those are BCL-XL inhibition with Navitoclax, bromodomain inhibition with Pelabresib, and PI3 kinase inhibition with Parsaclisib. So for the PI3 kinase in particular, this is a nice program because that pathway has been shown to be active in both solid and liquid tumors. And so what we saw in the early stages, so that's called phase 1, phase 2, is that there was not only safety and feasibility, but effectiveness of adding the PI3 kinase agent for patient responses. And so we'll eagerly await the randomized phase 3 data to help us to understand and see if we can confirm those early observations.